Hi everybody. If you've been following us for any length of time, you will know a little bit about our clinic and a little about who we are. We're Physical Therapy San Pedro. My name is Dr. Janae Brown and I'm the owner. And this is Dr. Bay to my left, Dr. Palermo to my right, Dr. P is what she goes by. We want to just come and talk to y'all a little bit about our space, our new clinic. We have a lot of things going on, a lot of new things going on. Dr. Bay's new to our team and she's joining us for the first time today to do this sort of discussion and give you guys a little bit of idea about who we are. So we wanted to come and talk to you guys and just let you know who we are, what makes in our new space with our new logo, and let you know why we're different, what sets Physical Therapy San Pedro apart from your traditional physical therapy clinic. So a little bit about myself. I opened my clinic 4 years ago. Just me, myself. I did everything and brought on a physical therapy aide shortly after. My team grew really quickly. In the beginning when I opened, I wasn't really sure what that was going to be like. And it sort of developed over time. I was an athlete. I played basketball. I love sports and I love the body and activity, but I slowly came to realize like this is something that I want to make my clinic, the emphasis of my clinic, work with people who are active, who are athletes, and I had been in a lot of different settings working. I worked in pretty much every setting, from Pilates to outpatient sports, to an outpatient clinic to inpatient. I was in management and I just sort of knew what I really wanted to do with my clinic. I wanted to be one-on-one with patients. I wanted to give them a full hour of treatment. I wanted to be quality care driven. And that slowly developed into the vision of Physical Therapy San Pedro. Over time, I brought in Dr. P. She was my first full-time physical therapy hire. It was a risk, it was scary.
But best decision ever.
Best decision ever. And just from there, our clinic has grown. We have 4 physical therapy aides right now, Dr. P, and then we brought on Dr. Bay in December to add to our team, and she's working part-time with our clinic now. So my specialties here are, I love working with athletes of any caliber. I'm rock tape certified. I'm a concussion specialist. I'm Pilates certified, so I do Pilates as well. And pretty much I stay away from some things. Some things I would say I have the most experience here because I've been a therapist for 16 years. So, they bring in some new things and I'm like, I'm a little skeptical, but I'm willing to try anything new. I just want quality care for our clientele and to deliver the best service. So that's a little about me. Did I leave anything out that you guys think is important?
That's great.
Okay, well, let's go to Dr. P. Dr. P will give us a little bit of information about who she is, and we'll talk through at the end kind of what sets us apart a little bit.
Yeah. Hi, everybody. Big thanks to Dr. Brown for building this brand new beautiful space that we're in. We are now considering ourselves a sports performance center, and I think it's awesome, and everyone should come in and check us out. But a little bit about me: if you have been a patient here, you've gotten to know me throughout the time. I'm Dr. Palermo. I go by Dr. P. I'm super passionate about just giving my patients the tools to thrive and learn how to maintain their own recovery process and get through their injuries and just be successful on their own. So if you ever work with me, you're going to get a lot of education on why you're here, what we're doing. You should always leave a session feeling that you understand everything we did and why, and know how to do it on your own to an extent. A little bit more about me: I'm a SoCal native. I'm from Riverside, California. I have tons of soccer experience. Like, I've been playing since I was a chubby little girl, 5 years old. So that was my passion early on. I think that's what got me into PT. I kind of followed my athletic trainer around in high school.
Very cool.
And then slowly kind of transitioned out of it and got into CrossFit. So I don't hate on CrossFit. I did that for a long time. It was actually like the best blessing for me because I learned the most about myself personally as an athlete. I learned a ton about gymnastics and Olympic weightlifting, and then transitioned out of CrossFit to Olympic weightlifting. So that's my main passion now, is the strength room and strength training. So super huge on helping any person feel like they can manage the weight room and manage themselves in a gym without fear and with good form and knowledge of what they're doing right for themselves. So yay for strength training.
You love strength training.
My specialties include functional range conditioning, so mobility specialist, strength coach, and women's pelvic health. So if you have any issues, postpartum, getting back to exercise, or there's a spectrum of issues I can work with as well. So I feel like that's one of my most unique specialties. So come see me for that if you have any issues.
I always say Dr. Pico's inside, I say on the outside, but she can help any. It's a unique, it's a unique thing, and I'm grateful for her.
Yeah.
Yes.
So I think I'm going to wrap that up. I just want to say that here at PTSP, goals are everything for us and our patients. So if you have a goal and you feel like you've been to a clinic and they're not addressing where you want to go, you should come here so that we can listen to you and actually work in what you want to get back to doing and get you there.
Absolutely.
Right?
Yeah, we'll talk a little bit more about that too,
Yeah.
like what makes us different. Dr. Bay, give us some insight about yourself and what makes you unique to our clinic here.
Thank you. Okay, hi everyone, I'm Dr. Bay. My full name is Miley Bay Hawkes, but going by Dr. Bay for short here. PTSP caught my eye as I was looking to progress my career, and I really wanted the chance to work with athletes and especially dancers. That's why I really wanted to come on to this team. In the last few years, I've been gearing my own personal practice as a physical therapist towards dance medicine. So I was really hoping to combine my past, and I still continue to dance, but my lifelong passion of dance with my passion of physical therapy and helping people move better. I am born and raised in San Pedro, so I'm a native to here, go Pirates, and it's just fun, the community that this place brings. You often find people that know each other or have a history, and it's been really fun to help people that my loved ones know in addition. What else? I went to physical therapy school at USC, and then during that time I became a certified strength and conditioning specialist from the NSCA, and after school I studied to become a board certified orthopedic clinical specialist. So that really helped my knowledge and to hone my skills for this population. And then also with my continuing education, I really honed in on a type of manual therapy that's more active based, because we really are big on movement and healing here. So functional manual therapy is what I like to perform to help people move better, and then I'm really big on helping people use what they gained. So we want to use our corrective strength exercises, and some of my favorite tools are Pilates, yoga, utilizing the TRX, kettlebells, and lately I've been certified in blood flow restriction training, so helping people that can't load really heavy yet start to get their gains and loading as quickly as possible. Yeah.
So much good stuff. I would say we're all, I don't know if you already said that, but we're all strength coaches in some capacity, so strength is important to us. We like to combine hands-on stuff. We like to touch our patients, and we want to do that, but we like to really get to the goal of like movement. What were you doing before? What do you need to get back to, and how do we get you back there? And that's probably one of the things that makes us most unique is we work in the middle a little bit. A lot of physical therapy clinics, they work on reducing the pain, getting the pain to go away, and then on your way. But we sort of really are restorative, and like, what were you doing before? You need to be at double Pilates? Okay, cool, let's figure out those movements that you need to be able to do and get you back. You were a soccer player, you know, we want to get you fully back to playing soccer. So whatever it is, you know, you're a runner, it doesn't matter, getting you back to where you were. So that's our big goal. And then really teaching people how, like you said earlier, like maintenance, how to be healthy for their lifetime, right? How to maintain. You're not gonna like not get injured, right? Correct. We can't like prevent injury, right? But we can reduce risk. We can be as strong as possible, as mobile as possible, as flexible as possible, and that helps us. You know, we need to, if we take care of our body, we have usually less, or injuries are less long. Like they're not as long, they're not as bad. We become a little more resilient, right?
I always say we want to build a functional athlete.
Yeah. Yeah.
And you can be an athlete at any stage. So that's what we provide here. So it's not just for the young youth athlete. We see ages, from 80 back down to 12.
Yeah.
Definitely.
So some other unique things about us, let's say, we're a girl team. So it's just kind of by chance, but then we kind of kept it going. But we're a girl team. All of our physical therapy aides have their bachelor's degrees, so they're very well educated, and they all bring their own cool experience and uniqueness with them as well. One time we'll have them in here with us. We have a gymnast, we have a softball player, a basketball player, an EMT, there's a strength coach, there's all kinds of different great qualities. Our newest hire, Maitland, is a rower, was a rower back. So we like to draw in our own unique skills, because we feel like that helps us we can't know everything, right? We can't play every sport and done everything. But as much as we can kind of meet the patient where they are, and if we don't know, me and Dr. P are on like YouTube, like, what does this football player need to do?
We learn quickly and on the fly. We will learn.
How can we create a passing drill? So we do our best there. What are some other things you guys feel like that makes us unique, like as a clinic? Some things you love that maybe you didn't have in previous clinics, some things you hoped would, some things you guys like here,
Well, I personally am loving the extra time I get to spend with my patients.
Okay.
I come from a background where I only got to spend 30 minutes and then I had to pass them off to an assistant. Here, predominantly, I get to spend the whole entire time, and to be able to give the patient the cues that I want and make sure to modify each exercise exactly so that my patient can succeed and know that, hey, I can move without pain. I can get this low, squat this deep, jump this high, and here's the right way to do it. That, to me, means everything.
Yeah, definitely. I agree. And like I tapped in earlier, we're just super goal-oriented, and we listen, which we have the time to listen to. So that's like one of my favorite things about this space is that we will stop and sit and talk and make sure we get your entire history and have you know where you want to go, and give you the tools to get there. It's just super special.
Yeah, for sure. We have turf, which is awesome. I always wanted turf in a place I worked in, just to do different things, running drills, or just turf is awesome for sled work. So we have that, which makes our center look really sportsy, looks really awesome that way, but also just very functional for us and our patients. We have really great equipment here. We have barbells and kettlebells and sleds and Pilates reformers and just sandbags, boxes. I mean, everything. Yeah, everything. Yeah. And
always adding them.
Absolutely. Yeah. What else? One thing I really wanted to do in our clinics too is just continue education. So I love being able to learn and grow together. So I make that a big emphasis in our clinic, and so
we're big nerds.
Yeah, we're nerds.
We love to learn.
Yeah, for sure, absolutely. So what should we leave them with, guys? That's a little bit about us. We want you to know who we are, introduce ourselves to you, tell you why we're different. I guess one thing I'd say to you is if you have an injury and you're not are hoping it's going to go away, it's probably not. So get with someone who can help you do the things you want to do. It's worth investing in your health. Dr. P always says that, you need to invest in yourself to get to that goal. So invest in yourself so you can do what you want to do. A lot of people get injured and they're like, well, I hurt my knee and that's why I can never play again. We don't live in that world right now.
Exactly.
Yeah, you can find help. Find someone who's good. We may not be in your area, but there are people who are, and we do telehealth. So if we're not in your area, we can meet you where you are, in Alaska, in Hawaii,
that's right.
Wherever you are.
We're up for the challenge.
That's right.
Overseas was a little bit of a challenge.
Yeah.
We've tried it.
You can follow us on YouTube, we have a YouTube account. You can follow us on YouTube, Facebook, Instagram. Check out this blog. We just kind of wrote out some stuff about ourselves. We post a blog every month about some fun, cool topic. And anything else?
If you want to see more on our clinic, check out the Instagram. I think we've done tours of our space, so
it's beautiful.
Yeah,
it's really
come
nice.
on
Good
in.
stuff.
Ask us questions, and we'd love to see you.
All right, ladies, we're done, huh?
Yeah.
Bye, you guys. Have a good